But the reason, Kathleen Sebelius, we're having these conversations in the first place, the reason the Republicans have been so bent on changing the healthcare law is frankly because it never achieved it's now today more popular than it was, frankly, at any time since it was enacted into law. Everybody acknowledges there were problems with it. So to go back.
There's that website thing.
There was that website thing.
That did get fixed.
But there were problems with it from the beginning. And you and I have had this conversation earlier today. The premiums have gone up. A number of health insurance companies have just exited the market. We know a few others are looking at coming in. But there's been churn, there's been turmoil. And a lot of it, in my personal opinion, has to do with the difficulty in understanding it. It's been so complicated from day one and hard for people to get their arms around and understand until it hits them personally. And then when they have a bad experience, whether it's a higher copay or a higher insurance premium, what could have been done differently in the beginning to avoid this, or to avoid at least some of this turmoil?
Well, it's a great question, and there's some things about the framework of the bill that could have been written differently. Should the subsidies have hit at a different level? Probably. Should they be more graduated? Because there were either people in or then flat out. That caused a problem. I do think some of the churn is part of this marketplace. This market is a churning market. People are in and out. They may have a job, lose a job, be switching jobs, come out of college, whatever else. So there's always going to be some churn. One of the big changes is really having a package of benefits that every plan had to offer. And while it's complicated, I got to tell you, having been an insurance commissioner, been on the other end of the phone with people trying to figure out what in the world they were buying when they were trying to buy coverage for themselves, what in the world they were looking at with 26 pages of fine print that may or may not have caveats in it that took their doctor out and took their medication out. This was a plan where people knew if you bought health insurance, it had these features in it, and every plan had to have the features in it. That raised the cost for some folks who wanted skinny plans. But it was finally a health insurance package that if you got sick, you didn't go bankrupt. If you got sick, you actually had care. If you needed depression screening, you had it. I think that there's no question, there is no mandate in the bill that says insurance companies have to sell a product. Right. So could we have done more along the way to encourage more insurers? Probably. And the reinsurance pool that was there, I know this is very, I'm sure all of you read insurance manuals on a regular basis and are fascinated by this. But what the reinsurance pool did is basically say for the first couple of years, nobody knows, everybody's bidding blind. They don't know what rates to charge, and they don't know who their customers are going to be because there's no trend line in this market. So there should be a pool saying at the end of the day, if you, Judy Woodruff, running the Blue Cross plan, have many more old and sick patients than I do in my health plan, we're going to help you with some additional resources. You shouldn't get punished as a company. We want you to stay in the market. The Republicans took away that money year one. And I would just remind folks, I know I get a little bit defensive about this, but there was a declaration the day that the president signed this law that, first of all, 27 attorneys general, all with Republican governors, sued the administration saying the law was unconstitutional. There was a declaration by Congress that they were going to do everything they possibly could to defund and dismantle this law. And I think it has been under assault. So the notion that somehow this furor of Republicans is new is just not accurate. It's been a war for 7 years with a lot of misinformation, a lot of confusion. States that we're all in, Colorado, we're in a great all-in state. The governor said, I want this to work. I'm going to run a state exchange. I'm going to expand Medicaid. We're going to give information to our consumers about how to use it. We're going to have our public health people reaching out. Colorado has done extremely well and had a lot of robust sign-up. Other states where the governor blocked it, I mean, Florida passed a law that enrollment individuals trying to find people to say you qualify for health care, you have a subsidy, this would be your first time. It was illegal to use public property to enroll people for health insurance.